All right. Good morning.
Good morning.
And your name?
Gosia.
And
Gosia
it's
Zavala.
July 2011.
Right.
Okay. And so we're at Innovative Back Solutions, where you've received some treatment for your back. And but I wanted to ask you first, and how you injured your back to begin with? What happened to you?
I was in a car accident in 2008, July 2008.
So we're about 3 years ago.
Yes. And it was a head-on accident. I was watching two cars getting in a collision, and one of them went straight at me. So I was kind of watching this happening, which helped me slow down, and I couldn't get out of the way, and I braced myself. I didn't want to hit my head, so I absorbed the impact in my lower back, and I injured my lower back.
Oh. And did you know it right away?
It was actually, I really started experiencing real problems maybe a few weeks
Later on.
But yeah, I knew it was a problem.
It was hard.
I knew.
And so since then, so we're talking 3 years ago, and you and I are just now meeting and talking about this. What have you tried since then to fix your back?
Oh, I saw chiropractors, rehab specialists, and massage, acupuncture.
Was you a regular doctor as well?
Of course.
Your family doctor?
Yes. Yes. I've tried. I thought I've tried everything.
Tried everything? And how did you hear of Innovative Back Solutions?
From a friend.
Okay.
When I was really very low, and my back just went out. It was maybe in January this year, and I was
By
in a
very
lot of
low,
pain.
you mean you were
You
were in a lot of pain, not happy,
yes.
and depressed about it, right? Because you had no solutions.
Yes, and I almost started considering injections.
Okay.
A friend of mine, I don't know if I can say her name, so, but she recommended it.
Okay. And so you end up in here. And what did they tell you is wrong with your back?
Bulging disc.
A bulging disc? And quite painful? What kind of
Very
pain were you
painful.
in? I mean, what was it doing to you? What kind of pain did you suffer?
You can compare it to being beaten up in that area, and at some point when it would just lock and you won't be able to move.
And how'd that affect your life overall? What things did you realize you couldn't do that you used to be able to do?
When it would lock, I wouldn't be able to do anything. But then I would have to just take lots of painkillers and keep working for me.
And that is what you do, right? You're a musician?
Yes.
And so is it hard, it must be hard to play an instrument when you're in pain?
It's very hard.
Because it's emotional.
But it would affect every aspect of my life.
Right.
I'm very active, and I love doing things.
And
Gardening, and I forget that. I couldn't do it at all.
yeah, I've heard that before. So you come to Innovative Back Solutions and you meet Dr. Ruano,
Yes.
and he assesses your situation. So what's the treatment been like in his office?
Amazing. First he gave me hope, which I was really giving up.
Yeah.
And then he looked at MRI, and he wanted to make sure that I qualify for the treatment. And the treatment was very intense. It was, I don't remember how many sessions, three times a week. Very, very intense sessions. I couldn't do anything. I was not recommended to do any exercise, or just go through the treatment. And then after the treatment...
Were you doing the DRX machine at the time?
Yes,
and actually getting on the table, the DRX machine, I mean, that's fairly relaxing, and
yeah, but it's pretty intense. I mean, you can feel that
it working.
You're being pulled apart.
Right. They're stretching you a bit.
Yes,
okay.
yes, but it's absolutely.
And when did you start to feel some improvement?
Pretty quickly. I can't be very specific.
A few weeks, maybe.
Yeah.
I'm guessing.
Yeah, I started feeling the improvement. It was gradual. I would have better times and worse. But I followed exactly what he said. I just wanted to go everything and do everything by the book.
Good, good.
And then he started with exercise therapy and massage therapy. He has a very good team to help you, to teach you how to deal with the injury, because I think I'm going to be having this forever.
You're going to have to learn
So
to
I
deal
have
with
to
it.
really-
Now, are you in, so you're getting better.
Oh,
And how much better are you now than, let's say, when you came in here?
no comparison.
Really? You think you
It's
maybe
phenomenal.
can
I
do
feel
some of the
like
things you hadn't been able to do?
First, there's no pain.
Well, that's great. No pain is a good thing.
No pain is a great thing. I still deal with some fear.
Right.
So, but I'm really getting stronger, so I am losing the fear of
Good.
movement, because I don't want to feel this ever again. So I think the people here are so caring, and they really try to help you deal with all aspects of this injury. So I highly recommend it.
And so after that, so after DRX, I mean, you've been through all kind of physical therapy now with them, and you're exercising and able to do things that you maybe thought you might not be able to ever do
Yes.
again.
Yes.
And so the prognosis and the future?
I am afraid to say anything.
You don't want to jinx it.
I don't want to jinx
It
it.
feels
but,
too good?
But yes, it's amazing. It's
Good.
been amazing few weeks, and the treatment was a few months. It's a long road. It's not like it happens overnight. I don't want to lie, because that would be a lie. But I really followed every exercise they recommended and everything they were teaching me. I even videotaped the sessions to help myself
So you could do it.
remember the form. And I really think that you can't believe in a miracle overnight. It's not like a
Right.
pill that you can swallow. It's a lot of work.
It's work.
This is a full-time job.
It's good advice. All right. Well, we thank you so much for your time today, and thanks for coming in.
You're welcome.
Thanks a lot,
Thank you.
Gosia.